Joining me now is allergist Dr. Praveen Buddiga. Dr. Buddiga, thank you so much for joining us. This is a very busy time of year, I'm sure, for you anyway, because it is allergy season, but are you now seeing more patients out of concern of the coronavirus?
Thank you for having me. This is Dr. Buddiga. And actually, we're doing telehealth right now for another week because of the social distancing recommendation locally by the public health department. And we should be opening up our clinic again to see patients within 10 days. And I have shown that, yes, we are seeing, it's a combination. It's of allergies. We're seeing a few patients come in with fever who are very, very concerned whether they have COVID-19. So those are the patients that we kind of check their temperatures. If they're above 100 or so, then we direct them to the appropriate place, which would be the local hospital for testing.
Can some of the symptoms of just allergies or even asthma be similar to COVID-19? Is that maybe, perhaps causing some maybe unnecessary fear or concern among patients?
Yeah, how we distinguish mainly between allergies and COVID-19, and remember also we're towards the end of the flu season right now. So luckily, but the main differentiation between allergies and COVID-19 is basically in allergies, you don't have a fever, you don't have body aches, and you don't have pain. So if you're sneezing, if you're coughing, if you have red, watery, itchy eyes, runny nose, or a postnasal drip, or a stuffy nose, this is more consistent with allergies. But COVID-19 is a complete different, set of symptoms. You have fever, you have shortness of breath, really fast onset. It comes really fast, and you have a fatigue, like you got hit by a Mack truck or something. And some of the patients who have complained with COVID-19 have a loss of sense of smell or loss of sense of taste. So if any of these symptoms come up, fever, dry cough, difficulty breathing, or loss of sense of smell or taste, and fatigue, at least two or three of those symptoms, I would go see your doctor or call your doctor for further guidance.
Yes, those would be red flags. For people who do have asthma, and we know that is a very common condition here in this area, are they more at risk of suffering severe symptoms if they do become infected with this virus?
Yes, they are, because we all know that asthma is a respiratory condition involving the lungs, and COVID-19 does the same. It attacks the lungs. And so people who have predisposition to asthma or have asthma are at a higher risk.
What precautions then are you advising to your patients during this time where we are so concerned about the virus spreading in our community?
Well, I've been very active about this, voicing this from January 22nd on my website, on my Facebook site, saying that patients need social distancing we need to mitigate or decrease our exposure outside, and wash our hands almost about 20 to 25 seconds thoroughly with soap and water, and really don't touch your face. And that's the key, is not to touch your face, meaning you can't touch your mouth, touch your nose, or touch your eyes when you touch another surface. And because
What about masks? Today, the CDC is now recommending that Americans, especially in high-risk areas, which maybe that doesn't necessarily relate to where we live, but are you recommending to your patients who have, severe allergy cases or have asthma that they wear masks when they go out in the community?
only those with severe illnesses like comorbidities like asthma, heart disease, diabetes, or other severe or other compounding disease problems, I'm recommending them to wear masks. At this time, I'm trying, really the winner here is if a person stays at home in a way, does, like I'm doing telehealth right now for the next 10 days, But after that, I'm an I'm an essential person who needs to be out there, so I'll be opening my clinic. So yeah, I would recommend those patients are people who are in large, who go out like shopping or who are shopping in for grocery, that is, to do wear a mask, especially because you don't know what the person, whether he's obeying the 6 feet rule or not, or isolation. You don't want to be that probability statistic.
That is so true. Dr. Praveen Buddiga, local allergist, we do appreciate your time today. Thank you so much.
Thank you very much for having me.